Hi everybody, and welcome to another edition of Stay Connected with the Worcester Senior Center. I'm your guest host, Dr. Michael Hirsch, the Medical Director for the Worcester Division of Public Health. I know you are a very, very observant crew. As I was walking in this morning, a very nice volunteer, Mrs. George, said, "Oh, I see you all the time on Stay Connected." But I'm not in my normal habitat. My normal habitat is this beautiful studio in the Worcester City Hall that I can do all these great recordings. Instead, I'm in this beautiful facility, and I'm telling you, it is beautiful, but you may not know what it is. So I'm going to tell you a little bit about the COVID update stuff, and afterwards, you'll find out where I am. Fall has come, and that's the most beautiful season in many people's opinion here in New England, with the leaf peeping going on and great harvest ceremonies. And of course, we've got Indigenous Peoples Day, which is a nice long weekend. And then we have the end of the month, we'll have Halloween. It's a really nice time. The apples that you might go picking are delicious. Maybe your family will pick you some. I hope they do. I'm here basically just to kind of give you an update at where we are in the city's health. I think in general, we're in a much better place than we were in October of 2021 and certainly in October of 2020. But despite what you may have heard late last month from President Biden, I think he kind of overreached a little bit in saying the pandemic is over. It's not over. And the reason it's not over is because there are large swaths of the world that are unvaccinated, and those are the breeding grounds. Those unvaccinated people who catch COVID are the breeding grounds for new variants. And the new variants come along and change the dynamic, because each one that comes along seems to be more transmissible. It may not pack the same punch as the previous iterations, but it is definitely a challenge to your immune system. And so, fortunately, with the summer months, we've had a BA5 and a BA4 mini surge, and we haven't seen the hospitals fill up, we haven't seen the ICUs fill up, and most importantly, we haven't seen the morgues fill up. But there are still people catching COVID. Guess what? In September, I caught COVID. I thought I was being the most careful person in the world. I do go in a lot of places in the city. I get dispatched there by the city manager and our media people to try to be present for presentations and other events. And I'm also working in the hospital as a pediatric surgeon, so there's quite a bit of COVID left circulating in the emergency department, and that's where I do a lot of my work. But I never caught it. How did I catch it? I went on vacation. I was supposed to bring my pet corgi dog to my son's house in New Jersey for him to dog sit so that my wife and I could go on our little jaunt. We were planning on doing 4 or 5 stops over a 2-week period in the car, and my son had COVID. I didn't know it. He didn't know it. One day after we arrived to drop the dog off, when we were going to be leaving on our trip, he got sick, he tested, and he was COVID positive. So that's the old story, and I feel embarrassed because I've been preaching that. If you don't know who's in your pod and you don't know who's in the party that you're having, whether it's a Halloween party, party for the long weekend of Indigenous Peoples Day or Columbus Day, if you want to talk about the older version, then you are at risk. And the best protection you have if you don't know who you're with is the mask. Now, I'm sure you're noticing, as I have, that fewer and fewer people are wearing masks. And you don't have to wear masks outside. But indoors, if you're going into a tight space, whether it's a restaurant that's very, very crowded, or a sports bar where you're going to watch a game and everybody is drinking and screaming and not wearing their masks, it's probably advisable, particularly if you're in that high-risk group like we've always been talking about. That means over 60, cardiac or pulmonary or heart or lung disease, immune disease, diabetes. These are the things that make you a higher risk person. I would not throw that mask away yet. It's just not safe. Now, I know that when you travel, if you go on planes, if you go on trains, they're not requiring masks anymore unless it's international travel. But I think the safe thing for those scenarios where you're breathing air that's kind of stale and getting recirculated, especially with our numbers kind of still in that plateau where we're seeing too many cases each week, keep wearing your mask. But the most important way to protect yourself would be get up to date with your vaccination. So you probably heard about this new booster that's come out, which is called a bivalent booster. And that is supposed to be protecting you against the original coronavirus model, but also the Omicron variety of variants that started last December now is included in the vaccine, that booster. And so long as you're 3 months out from your second booster, when you took the original shot, right, you had to wait 3 months to get a booster, then you were supposed to take another 4 months to get the second booster, whether that was Pfizer or Moderna. If you're past 4 months out from that second booster, you can get this new one. And it's a very, very potent one and is likely to keep you safer than almost anything you can do. And I think that that's a very good idea for you to go get one. Now, a lot of people are like, I already have COVID. Do I really need a booster? A lot of people, and I'm sure you know them, have gotten COVID more than once because the original COVID infection that they got was of the original variety. And then when the Omicron variants came along, Omicron variants kind of escaped the immunity that you got from either having that first infection or getting vaccines subsequently. So now we have a tool against this Omicron variant stream. And I think it's very, very wise, especially in our seniors, to get it. So it's very easy to get. It's widely available. Here in Worcester, we have continuing vaccination clinics at the Worcester Public Library on Wednesdays and Saturdays. We can give a person of any age the right vaccine. If you haven't had the first one, we would urge you to start that cycle and get vaccinated. If you missed the second booster, or if you missed your first booster, or if you're now all caught up but you want to get another booster, this bivalent one is the one to get. And we can do it from any age from 6 months up. So if you want to make it a family affair, get everybody from your family who is not up to date to come with you, and you can get your up-to-date booster. Now, that being said, if we're talking about vaccinations, very important this year, we feel, is the flu shot. The predictions are that we are going to see a winter surge of COVID. And that's usually when the flu starts to cause its peak. So it's very, very helpful for the people that take care of you, the people that love you, to know that you've had flu shot, because if you develop a respiratory virus of some sort, it's more likely to be COVID. And I just want to make another comment about testing. We are not having as much public availability of testing for COVID. All the drugstores do it, and all you have to do is go online, enter some information, and you can get it, whether you have insurance or not. Most of you do have insurance, but it's not a hard process. Walgreens, Rite Aid, CVS, all of them are doing it quite regularly. If you get the home tests, the antigen tests, and you can still get them widely available. They're giving them out still at these clinics that we have in the public library as well. They are not as sensitive to this new BA.5 variant than the original Omicron. So it takes at least 2 negative tests to be confident that you don't have COVID. So if you feel like you got symptoms or you clearly got exposed, like I did to my son who had a positive test, the first test I took was negative. I waited 48 hours after my exposure, and it came back negative. I really crappy. I felt like I was, having a really bad flu. I had aches. I was having chills. Said this can't be right. I tested the next day. It was positive. So you've got to give yourself at least that 2-test thing before you say, I'm good to go. I can go. And think about this. If you've got symptoms and the test is negative, are you really going to go around and start like congregating, socializing? No. But if you had to go out, and get a bottle of milk, or if you had to go out and get gas in your car, wear a mask. That's when you have to wear a mask. That's what we're telling now the school systems, that there's not that kind of same vigilance as we had last year with test and stay. They're not doing that. They're just urging parents, do not send your kid who's symptomatic to school. And we're hoping that more and more kids will catch up with vaccinations. But there's still a lot of reluctance on parents about the COVID vaccine. So we're still only at about 30% compliance in that 5 to 11 group. It's even lower. It's maybe about 18% in that 6-month to 5-year-old group. And the group that's between 11 and 17 is about 50% now. As a whole, Worcester has been stuck for complete vaccination at 64% forever. Now, the fact that so many people have gotten COVID, we probably have more in the way of immunity than just that 64% number, but we'd like to see more. So I don't think the pandemic is over. There's a lot of things you have to think about. But if you're going to an outdoor football game and, it's a nice, beautiful, crisp fall day, I don't think you have to worry about it so much. It's just if you go inside the locker room or you go to a restaurant after the game to celebrate your grandkids making the touchdown catch that turned the tide, then you got to think about wearing a mask, especially if you're an old geezer like me. So as far as monkeypox, which was another topic that we talked about last month, we fortunately have not seen a big uptick here. We're still totally only been following roughly 20 people with monkeypox. Since you remember, this all started like end of July, so that's not a very big number. And we've tried to use a lot of good public information both on our website. I've been out doing radio shows. Our medical director, Zach Dyer, has been working a lot with the media to get the word out. And I think people understand that this is not a widespread epidemic. It seems to be concentrated in the gay male community predominantly. There have been some sporadic pediatric cases in families where 2 gay males are raising a child, and a couple of cases in the caretaker community of people that have been caring for gay males, either as attendants or as housekeepers in a hotel situation. But with those exceptions, we haven't seen a lot of monkeypox outside of that community. and the gay community has responded really well with a lot of internal social media to try to dissuade the population from activities that could make the likelihood of getting monkeypox or spreading monkeypox higher. So kudos to that population. So hopefully this is not something that you're going to be faced with, but if you did have a case of monkeypox in your family and you had close personal contact with that individual, there is a vaccine available. It's distributed at AIDS Project Worcester. You have to go online and schedule an appointment to get the vaccine, but it is something that you can avail yourself of, particularly if you are a high-risk person with immune problems or other reasons that would make you more susceptible to a more severe infection. But the good part about monkeypox is that its mortality rate is very close to zero. It's not that kind of virus that's going to kill you. You'll have a very itchy month as you first get the virus, then you get these lesions on your body that can be anywhere, but they're usually predominantly hands and feet to start, with little blisters that turn into pustules that then drain the pus, scab over, and then the scabs go away and they don't leave any scarring. That process takes about a month, and when you're done with it, you don't really have much to show for it, fortunately, and there's no evidence that it causes any long-term damage, which is the next thing I'm going to mention about. Long COVID, long-term COVID, long hauler COVID. These are all the terms that we see for people that had COVID 2 years ago, 1 year ago, now this year, where the symptoms aren't completely going away. The most common one is fatigue. A lot of people complain about just being weak and not being able to sustain their normal level of activity like they did before they got the infection. But some have very specific complaints about chest pain, about feeding intolerance, like they just don't have the same appetite. Some from the original COVID infection still are having problems with taste and smell. And we have others that have neurologic symptoms in their hands and feet, muscle weakness. People that used to be marathon runners suddenly say they can't walk a city block. These things are with us. We don't know what % of people get long COVID. There are a lot of studies going on to try to figure out who's the most at risk for getting long COVID. But I just want you all to know that if you did unfortunately have COVID and 3 months have gone by and you're still not right, there are ways of accessing long COVID clinics. There is one at the Brigham Hospital in Boston. We haven't established one yet here in Worcester. I'm hoping that we might be able to, but at least talk to your primary care doctor about the possibility of getting help and evaluation for that. So I think that's it for our infectious disease warnings and updates. If you have younger family members that are behind in vaccinations, little kids that because of COVID, the parents didn't want to take them to their well-child visits and they missed out, remember this. In New York City, there's an emergency going on because polio has returned. Now, polio was almost completely eliminated in 1980, and it started to come back because there are swaths of the population, not just in the New York City area, around the world, that are either not believing that vaccinations are safe or just missing the vaccinations, and that's allowing polio to come back. You guys might remember, like I do, what polio was like, but your kids and your grandkids, they don't have any idea. But I remember as a kid in the 50s, that every summer, if a kid came up with fever, weakness, headache, oh boy, your parents were going nuts because they thought you might have polio like President Roosevelt did. And I'm 68, okay? When I was an intern at Columbia Presbyterian Hospital back in 1979, I took care of a ward of iron lung patients. We don't have iron lung patients anymore. These iron lung patients would literally be polio victims that could not have enough muscle strength to breathe on their own. But instead of keeping them on a ventilator with a tube in their mouth, they were kept in these big iron coffins just with their heads sticking out. And the pressurized way that we could control the iron lung, we could make the chest wall pop out and we could make the chest wall go in. And they were stuck there for the rest of their lives. It was like the worst thing ever. Do we want to see polio come back? We want to see polio make a comeback because people now don't believe in vaccines because of the COVID virus? This is crazy town. So we've got to do something different. We've got to start trusting once again in our primary care doctors and our pediatricians and our family docs. They are not going to administer an unsafe vaccination to you. And I would include the COVID vaccine in that as well. But at least go back to what the 16 vaccinations that every kid is required to get by the school system. You've got to go back to that. So if you're the matriarch or patriarch of your family and you find out that one of your siblings have kids that are behind in their vaccinations, please encourage them to get caught up. There's ways of catching up no matter how old you are, and that will save a lot of grief. We're going to start seeing crazy recurrences of diseases that we long ago thought were conquered. We don't need that. We've got enough going on. So that's it for Public Health 101 for the month of October. I really want to thank you for listening in, and we'll see you next month. So hi again, it's Dr. Hirsch, not sitting, not in the studio, and maybe you were wondering where I was when we just did our segment on October's version of Stay Connected. Well, we're sitting in this beautifully refurbished area of the Worcester Senior Center that's become a gym. And Paul Lee is going to explain to us exactly what's going on here and all the different available pieces of equipment and programming that folks can do to keep themselves in optimal shape. You know, one of the things that has been found in the COVID epidemic was that obesity gave you almost a 35% more likelihood of contracting COVID, and that the severity of the case that you contracted when you were obese was much worse. So a lot of what you're seeing here can help avert that kind of a problem and just give you the muscle tone, the balance, and the kind of safety factors that will keep older people from becoming patients. So Paul, very nice to see you.
Very nice to meet you.
Very nice to have you here.
Yeah, with the beautiful new fitness facility at the Worcester Senior Center. A lot of thought and effort went into designing this facility. You know, from the companies we chose for our cardio equipment to the Kaiser machines, and they all had a specific thought process and reason in mind based on the clientele that we were going to see here. You know, kind of like to your point about as we age, staying fit, staying healthy is super important, but it's also dealing with things like osteoporosis and losing muscle mass and things that just happen naturally, and the things that we can do here to kind of offset or slow down that process is kind of what our goal is really. Different types of treadmills, ellipticals. Some people may have hip or knee issues that can't handle the stress or impact, so the ellipticals might be a better option for the treadmills, and we have two different types of bikes, upright and recumbent, again, depending on what issues we might be finding. And interestingly, just in the short time we've been here, we've noticed the biggest thing that jumps out right away is the gait pattern changes as we age. So we've noticed a lot of people will get on the treadmill and they'll shorten their stride and they'll be leaning forward. So we've been trying to incorporate better posture and regaining normal stride length, which helps with the balance factor, right? We deal with a lot of falls, which lead to broken hips or broken femurs, things like that. So if we can improve the gait pattern and the balance, that's just a huge plus. So that was kind of thought process with the cardio equipment. Behind us here, we have Kaiser equipment. Kaiser is a great company. They use hydraulics. It's all air-based. So you can control increase and decrease resistance just by pushing these buttons. So no heavy clunky weights, no things like that. Another great benefit to these is it's 0 pounds all the way up to a couple of hundred. So you might have someone where 2 to 3 pounds might be all the resistance they can handle. If we're dealing with the traditional weights, you don't have that. So this just allows us to give a broader range of population access to exercising. They came up with a great 6-station circuit for us to follow, which if you just go down the line, you have upper body push, lower body pull. You work the chest, the back, the legs. And when you get from station 1 to station 6, which is a leg press on the end there, you've worked your entire body out. So they made it very simple to follow. They made it very efficient. And it's just, it's a great company to use. Their equipment is always top notch. Olympics, the Olympians use a lot of Kaiser equipment in their training. Pro athletes use Kaiser, and it's definitely appropriate for the members that we have here at the Worcester Senior Center.
So Paul, how do people sign up? And how do you evaluate them to see what's the right workout for them?
Yeah, no, it's a great question. If you're a member of the Worcester Senior Center, as of right now, it's free. It's part of the membership. There's no extra charge to use this beautiful facility. When people come in, they have to fill out some paperwork. They have to get cleared by their physician. And then we set up an orientation. And during that orientation, we take them through all the different equipment, not only show them how to use it, but we're also watching them, observing how they move. And we might notice, if we notice a movement pattern with either the knee or the shoulder, we're kind of trying to say, like, hey, maybe this exercise might not be so good for you, putting stress on the shoulder, or if people volunteer that they've had rotator cuff issues, then we might kind of steer them away from one exercise to another. So, sometimes the orientations are 2 or 3 people at a time, but there is still some sort of an individualized observation process where we can kind of assess them while we're taking them through the tour.
That's great. And is it open like 5 days a week, or?
Yeah, right now it's Monday through Friday, 9 to 1, as we're kind of getting we've only been open a couple weeks. We're trying to get the staffing settled. Mm-hmm. But the end goal is to be here from, I think it's 6 a.m. to 4 p.m. For the senior center. Mm-hmm. And then I think there's also, they're trying to make this facility accessible to the city employees to come in. That's kind of why we have some heavier weights down on the end, because I think we're trying to cover a larger population. A lot of city employees might want to lift heavier depending on their job and things like that. So we're trying to cover both ends of the spectrum there.
And Paul, when a person comes, what's the general recommendation as to how frequently they should come during a week?
I think a lot of it really depends on where they're at individually. But generally speaking, I would probably say 3 times a week would be great. Mixing in, they recommend 15 to 20 minutes of steady cardio. So, you don't want the spiky high intensity, but you just kind of want a steady pace where your heart rate is slightly elevated. And then mixing in, obviously, to fight osteoporosis and muscle loss, things like muscle tone, doing the strengthening equipment, whether it's body weight or using resisted exercise, is super important. So, at the end of the day, we would love to see people in here 2 to 3 times a week using the facility.
It's really impressive, and I think just from my, I'm 68. I know that for me, it's very hard for me to duplicate any of this stuff at home.
Mm-hmm. Right.
I mean, you can get a weight here and a weight there, but nothing as elaborate as these. And to have it all in one place with some experts there to kind of guide you that's fantastic. Yep. What a great resource.
And I think we're also, this is set up for someone that likes to come in and work out on their own. But I know there's also plans in place to offer, I think it's 5 classes a week that will focus on balance, maintaining muscle mass, fighting osteoporosis, and it'll be age appropriate for the senior center. Mm-hmm. But that will be for someone who wants more of a structured program to follow and wants an instructor telling them what to do. We'll be offering those in the near future as well.
Great. Well, I'm thrilled that you were here to explain to us a little bit. Do you want to just kind of show us a little bit more of these
yeah, sure.
Kaiser machines? And
yeah,
absolutely. I know people are, when they see these big hulking things, they get a little...
It can be a little intimidating, right, yeah. So Again, the beauty of it is each of these with the handles, if you just push these plus minuses, that's how you increase, decrease resistance. They're very easy to use. This, for example, is a back machine, so you would just kind of sit and pull right to the chest and control. And depending if someone has shoulder issues, they have multiple grips. So by changing your hand position, you can move the shoulder in a different pattern. And then right behind you over here, these two cable columns are very versatile. Multifunction use is why we got them. You can just simply by pulling this pin, you can raise or lower the anchor. We have all the attachments that you could possibly use, including belts for some people, where again, walking with balance might be an issue. You can belt them up and have them do a little bit of resisted movement to help facilitate that as well. So these are when they got together to design this facility, there again a lot of thought process, specifically focusing on who we were going to be working with, what primary issues we were going to be dealing with the most. And these machines are fantastic for, again, simplicity of use and ability to adjust on the fly very easily. You don't want someone who's 85 and trying to get in here having to worry about moving 10 and 15 pound plates when you can just push a button.
It's great.
Yeah.
It's really great.
Yeah, you did a great job.
Well, I want to thank you for taking us around. It's a beautiful facility. I'm hoping that people take advantage of it. Certainly the seniors that listen to this program are very motivated to have good health. So I think this is a very big part of it.
Yeah, absolutely.
Heck, I'm a city employee and an elderly guy. You may see me in here next week.
Yeah, again, if you're a member of the Worcester Senior Center, it's included in your membership, so no extra fee for a beautiful spot like this to come work out.
Great, great. Thank you very much.
Thanks for having me.
It's great to meet you. So that's it from Worcester Senior Center's new beautiful gym. Take advantage of it. It's really for your health and for your benefit, and you can talk to your teenage grandkids who love going to the gym and just explain, I got a better one than you have.